I was trying to insert a, hopefully without objection from anyone, our Public Health Director, Ginelle Jones, is here and would very much appreciate an opportunity to give a report to the board and to our community before we open it up for any type of public or privilege of the floor. Is that agreeable with our board?
Yes.
Yes.
Thank you very much. Ms. Jones.
Good morning, everyone. I just wanted to provide an update with our success of our vaccination campaign to date. Our goal is still to vaccinate 100% of our communities. Our partners to date have been Glens Falls Hospital, Hudson Headwaters, our pharmacies, our skilled nursing facilities, Office of the Aging, other providers, our squads, our EMS squads, the Glens Falls Fire Department, in addition to the New York State site, which we're very happy to host in our county. We vaccinated seniors. Our estimate so far is that we vaccinated 70.9% of our seniors. It's hard to get a feel for how many of those seniors might be in Florida. You know, we don't get the records from Florida, and we don't know how many of our seniors are in Florida. So it's very difficult for us to know exactly how many we have. And speaking with Dee Parks through Office of the Aging and in just kind of measuring some of our phone calls and looking at our wait list, we feel that we've adequately served that population. We don't have seniors still looking. I'm sure there still are some out there. We're not gonna stop looking for seniors to vaccinate, but I do think we have hit a majority and have kind of saturated that population. In addition, we've done 295 homebound. We offered a clinic at Open Door. We've done 25 vaccinations there. We've offered vaccination to the jail inmates, of which we've done 35. We're still working on that population, and we'll still continue to work with Open Door and any other populations that would like us to work with them. We've also been working very closely with the OPWDD population as well. As far as first doses that Warren counties provide, Ryan does a beautiful job every morning of updating us where we are with our percentage. Currently, we're at 46.1%, where the state average is 39.6%. And those that have completed, we're at 36.1%, where the state's at 26.4%. I'm very proud of those numbers. Our staff have worked very hard in addition to our community partners, such as Hudson Headwaters and the hospital and the other providers that have helped us get to that number. We've been very lucky not to see severe adverse reactions, and I'm happy for that as well. As far as clinics, we've done just over 70. We've done 33 first dose clinics, 33 second dose clinics, and we've done about 5 J&J clinics in addition to clinics for the homebound, clinics for the Open Door, clinics for the jail. Those are kind of all hard to put in that total number just because it's piecemeal and how that happens. So with the pause, I know as of Tuesday, all of you are made aware that J&J had a pause. That's actually good news. It shows that the system works. With the vaccination campaign through the Communicable Disease Control Program, or the Centers of Disease Control Program, anybody that vaccinates or anybody that's vaccinated is part of a VAERS system, which is the Vaccine Adverse Events Reporting System. We're required to provide documentation to people on how to make those reports should adverse events happen. Out of the over 7 million doses that have been given to date, 1.4 million, roughly a little bit over, have been given to females aged 18 to 50. Through that VAERS Vaccine Adverse Event Reporting System, that's where the 6 incidents have been found that had significant reactions. And the good news about the whole VAERS system is it allows the ACIP, the Advisory Committee on Infection Control Practices or Immunization Practices, to step back and say, let's investigate this. Let's see if we should go forward. Let's see if we need to change the recommendations. Let's see if we need to pause. Let's see if we need to abort it altogether or whatever. So the system did work. We did have the reactions that were found. The reaction that was found is called cerebral venous sinus thrombosis, or CVST. That was reported. That's basically presence of blood clots that are in the dural venous sinuses or the cerebral veins, or both. basically a blood clotting disorder. J&J has been used since March. I attended a CDC briefing yesterday that discussed those 6 cases. You probably know most of what I heard because the news has already put a lot of that out there. But we are seeing this mainly happen in women. We're seeing it happen in people aged 18 to 48, and most within 6 to 13 days of their vaccination. To date, 42% of the Janssen doses were administered in that window of the 6 to 13 days has already passed. But that tells us that 58% of the people are still in that window. So there's still the opportunity to maybe see more incidents happen. So this pause is important for them to monitor for additional symptoms. With that said, we're encouraging any of the public, and this is more directed at the public at this point too, anybody that has received a J&J vaccine within 3 weeks that experiences severe headaches, abdominal pain, leg pain, shortness of breath, should reach out to their provider so that they can maybe be monitored, tested, or assessed to determine if they may be having that reaction. In addition, I want to provide the information on the vaccine adverse reporting system. It's V as in Victor, A, E, R, S as in Sam, .h, S as in Sam, .gov. The phone number that people can call for questions is 1-800-822-7967. In addition, information can be found at info@vaers.org, and that VAERS is VAERS. So anyone with symptoms, I mean, we don't anticipate that we'll see them, but anybody with symptoms certainly can call. The pause is a good opportunity, as mentioned, for that investigation process and to monitor and surveil for further reports. The ACIP is going to be meeting to make their determination soon, but I would encourage, our goal is still to vaccinate 100% of our community. I love our stickers still. Want to get those stickers out to 100% of our population. Can't wait to start vaccinating our children. But for now, if people were scheduled for clinics for J&J while we're in this pause, if they could maybe seek out Moderna and Pfizer clinics. For the first time this past Wednesday, we had a Moderna clinic that we didn't fill. We had about 50 extra doses. And, you know, I know that we still have more people out there to vaccinate, so we have to really get the word out there. We have not seen this reaction or adverse event with the Moderna or the Pfizer. So those are still considered safe to be using. So we are hoping to use those. And just kind of a quick update as well. We've been told that the state's going to be, because of this, diverting all the J&J to the state clinics. So we're being told as counties we should not, or will probably not be getting Pfizer. This week, we did request to go in with a couple other counties in a collaborative effort to ask for a Pfizer tray to help vaccinate our 16, 17, 18-year-old students that are in schools. So we've been working very closely with our schools to do that. We won't know till over the weekend, and actually one of the other counties that we went in with will be getting that notification over the weekend as to whether or not we get the vaccine. I might not know until Monday. And I'm hoping that answer will be yes, and I'm hoping that we'll be able to use that vaccine. If not, you know, we've got Moderna coming instead of our J&J that we ordered, and, you know, that's only for the 18 and olders, but we're still trying to get those 16 and olders vaccinated. This week, we also passed out links to our schools. Albany and Schenectady had Pfizer doses that we were able to hopefully get some of our students down to get vaccinated, but that's our focus right now, is trying to get our students vaccinated, because those are the active kids in schools that are going to sports and everything else. And just another quick reminder, we are seeing an uptick in cases again. And, you know, I know it has a lot to do with maybe activities that were done over the spring break and travel. We're seeing family members getting it. We're seeing it go through families. I just am encouraging people to remain vigilant with the mask and the social distancing, whether or not you're vaccinated. We received 2 reports today of cases that were vaccinated fully that received or did get diagnosed with COVID. I think that brings our total to 8 at this point in time. All 3 vaccines, we've seen it with all 3. The good news is very minor illness And the other good news is no hospitalizations with regard to people that have been vaccinated that have gotten COVID. But just because you are vaccinated does not mean that you can't get COVID or spread it. So it's still important to take those precautions. With that, anybody has any questions?
Any questions for Ms. Jones?
Being at the end, warn you all out. Well, I hope everybody has a nice weekend. I thank you all for your support. And I do want to just bring light to the fact with the memorial dedication of the tree in honor of those that have passed. I appreciate that gift to our community. Thank you.
Thank you.
Thank
And
you.
thank you again for all your hard work. At this point in time, do we have privilege of the floor? Supervisor McDevitt.
Yes, very, very briefly. The day is getting long.